I like bring Susan everywhere. Even when I'm just meeting someone one-on-one, I just speak to Susan first. That was a lovely introduction. I always look around and say, are you talking about me? I appreciate the opportunity to be here. This is my second year at the CSCS conference. And last year was very exciting. And you guys have a high bar to get over from last year. That keynote was amazing last year. So I'm really looking forward to seeing what CSCS has to offer and the great reveal at lunch. I send greetings on behalf of the New York State Office for the Aging. And I wanted to spend a few minutes this morning talking about some initiatives happening in New York State and how it affects what we do every day in the Aging Network. So, starting at the highest level, in 2011, Governor Andrew Cuomo announced his belief that a fundamental restructuring of the New York State's Medicaid program was necessary to achieve measurable improvement in health outcomes, sustainable cost control, and a more efficient administrative structure. One of the commitments that came out of that was what I call the ABCs of healthcare reform. This includes initiatives such as FIDA, BIP, MLTC, DSRIP, all of those acronyms that we're all trying to get around the lot. All of these were designed to further the governor's vision and share a common goal of integrating medical, behavioral, long-term services and supports and social needs for New Yorkers' at-risk populations. So this morning I wanted to focus on three of those initiatives, MLTC, BIP, and DSRIP, and the potential benefits these programs bring to the Aging Network. Implementation of the Managed Long-Term Care Program, or MLTCs, provides Medicaid beneficiaries in need of long-term care services a benefit package through partially capitated plans, which include mandated services. So what's that mean to all of us, right? We don't typically focus on Medicaid. Some of those mandated services are provided by the Aging Network. These include home care through consumer-directed personal assistance and personal care programs, also provided under the Expanded In-Home Services for the Elderly, or ISEP. Other mandated services include social adult daycare, personal emergency response system, home-delivered meals or confit meals, home modifications, as well as non-emergency medical transportation to doctors' offices and clinics. So historically, we had to tap into Title III funds or state funds to provide those services in the Aging Network. With these changes under MLTC, we're now able to draw down Medicaid dollars to provide those same services. As the Aging Network continues to venture out in the new world of managed long-term care, more opportunities exist within the Balancing Incentive Program, or BIP. BIP is an opportunity offered under the Affordable Care Act, which provides financial incentives to participating states for rebalancing long-term care services and support expenditures from institution to home and community-based services. So that's really our focus in the Aging Network, is to help people either move from institutional care back into the community or to help older adults remain in the community. And BIP is going to allow us to do that. This entails three structural changes. It's going to be a creation of a no wrong door or single point of entry, development of core standardized assessment instruments, and conflict-free case management. BIP can be used for increased offerings or access to non-institutional long-term services and supports, and the BIP period runs from April 2013 through September 30th, 2015. And the state will be working on a sustainability plan beyond September 30th, 2015. One of the major features of the BIP initiative that may be of particular interest to the Aging Network is the No Wrong Door system, which will be our enhanced New York Connects. Are a lot of you familiar with New York Connects? Okay, I'm coming to a whole presentation on just that for you. Because this is going to fundamentally change how we do business. It's going to create a seamless and timely experience for individuals in need of long-term services and supports, regardless of age, disability, diagnosis, or payer source. The No Wrong Door will provide comprehensive information assistance and linkage to services for individuals. The use of technology will allow the state to create a virtual call center and appropriate data sharing by No Wrong Door staff in accordance with HIPAA compliance and confidentiality requirements. And lastly, I wanted to mention the Delivery System Reform Incentive Payment Program, or DSRIP. DSRIP is a component of the Medicaid Redesign Team, or MRT waiver amendment. This is an agreement between the Center for Medicare and Medicaid Services, or CMS, and DSRIP allows New York State to reinvest over a 5-year period $8 billion of the $7 billion in federal savings generated by reforms developed by the MRT. DSRIP is the main mechanism by which many of the MRT goals and objectives will be implemented, and the primary goal of DSRIP is to fundamentally restructure the healthcare delivery system by reinvesting in the Medicaid program, with the major objective of reducing avoidable hospital use by 25% over 5 years. The goals of the objectives of DSRIP will be achieved through performing provider systems, or PPSs, which represents a comprehensive network of providers who come together under a lead agency to help meet the goals and objectives of DSRIP. So you're asking yourself, so what's that have to do with me? What does that mean for the aging network? A lot of Medicaid talk in there. Well, partners of the PPS may include an array of providers: hospitals, health homes, nursing homes, behavioral health clinics, community-based providers, and of course, aging providers. Many aging network providers have already engaged with the PPSs, and if you're interested, I encourage you to check the Department of Health website to identify the PPS in your area and get involved. They only know you're there if you tell them you're there. So these incentives that I just spoke about are designed to meet the governor's vision of integrating medical, behavioral, long-term services and supports and social needs, which makes this an ideal time for aging providers. I encourage those in the aging network to become involved, take advantage of new opportunities that will solidify the state's commitment to older adults who have proven to be valuable economic, intellectual, and social resources to this great state of New York. Thank you very much.